How are you? Hi, everyone, and good afternoon. I'm excited to come your way once again to this. We are having a baby page and talk about pregnancy and the issues before pregnancy, during pregnancy, after pregnancy. I'm just happy to come your way once again. It's been a bit too long. We're just sorting out a few issues to make the presentations bigger and better. And hopefully, going forward, we've done that. So it's going to be exciting from now onwards. So, how was the last presentation? Did you use any of the tips that I gave to help you optimize your chances of getting pregnant? Or you are yet to do, if you haven't had a chance to catch that presentation, kindly go on any of our social media platforms, YouTube, Facebook, and just watch the video. It's on there. Just get a look at it. Try some of the things, drop in comments about how it helped you or which ones didn't help you, and then let's interact on these social media platforms. Today, however, we are going to talk about early signs and minor disorders or ailments of pregnancy. So, finally, we are pregnant, or are we? So the question is, could I be pregnant? If you're a woman and you are in your childbearing years and you are sexually active, this is probably a question you've asked yourself a time or two. Could I be pregnant? So there comes a time when you are wondering, I'm having these things, or my period has delayed. Is it possible that I could be pregnant? The only sure way to know is through a pregnancy test, which you may do at home or in the hospital. But there are some early signs and symptoms that may indicate that you actually might be pregnant. And these early signs and symptoms can start as early as the first 4 weeks before you may even miss your period. Does everybody get these signs and symptoms though? Every woman is different, and so are experiences of pregnancy. Even not all pregnancies are the same for the same woman. So this pregnancy may come with different signs and symptoms. The next pregnancy may be something that is totally different. So we are all different. We go through different experiences in pregnancy. Also, because the early signs and symptoms of pregnancy often mimic the symptoms that you might experience right before and during your period, you may not even realize that you are pregnant when you actually are, and especially in the very early stages. The symptoms below that I'm going to talk about may be caused by other things besides being pregnant. So the fact that you notice some of these symptoms may not necessarily mean that you are pregnant. So what are some of these early signs of pregnancy? So the first one I want to talk about is tender swollen breast, which is also a sign that you get just before your period, what we call premenstrual syndrome. All these signs I'm basically going to talk about because of that. And all of it is due to hormonal changes. There is a hormone in there that is called progesterone. And this hormone is very elevated in the early stages of pregnancy. And it's also the hormone that is kind of taking over the show just before your period comes. So if, as we learned the last time, if your body is preparing for a pregnancy and this hormone is in there doing its thing, if pregnancy doesn't come, then the levels of this hormone goes down. So all these signs and symptoms that are early signs of pregnancy will disappear after you don't get pregnant. However, if you get pregnant, then the hormone level also continues going up, and it's going up and it's going up. And so some of these signs and symptoms persist a bit more beyond what they do if your period comes. That is, if you do not get pregnant. So one of the first things you notice is that your breasts are tender and it's swollen. It's heavier than it used to be. You may find that your dress is a little bit tighter across the chest, and your nipples especially may be very, very tender. So how you get over this is to wear comfortable bras. If you were wearing a bra that was kind of scraping and you are uncomfortable, wear bras that are comfortable. Ideally, bras that do not have an underwire in them. They are cotton bras. They are really comfortable. And the other sign that you may see in early pregnancy is fatigue. You may realize that you easily get tired due to probably a lot of the other things that I'm going to talk about. Your breasts are tender, you are not even getting comfortable in bed. So, and again, the hormone progesterone just makes you sleepy, basically. So what you do is you try to get as much rest as possible as you can, and you eat foods that are rich in protein. One other thing too that you may notice is that you may start having some lower abdominal cramping. This is also common just before your period. Some people experience some cramping just before their periods. And this is also something that you may also see just as early in pregnancy as the first 4 weeks, week 4 to maybe week 6. This comes about again due to the levels of progesterone, and also because when the baby is implanting in the uterus, the cramping, the uterus contracts a bit and is kind of stretching and making way for the baby. So you may experience a little bit of cramping. There may also be what we call implantation bleed or spotting. Some people just around the time when their period is supposed to come may notice a little bit of bleeding if they are wearing a panty liner or even in their underwear. And this bleeding is due to the baby implanting, or the fetus or the embryo implanting into the wall of the uterus. And it's bleeding that should not be alarming. It's not a lot. It's not going to soak your pad if you are wearing one or your underwear. Most of the time, people even notice it after they use the washroom and they kind of are wiping down there. That's when you notice it. It may be reddish, but it quickly turns brown. But most of the time, it's brownish. And this is what we call spotting. Again, some women notice that they get a bit bloated just around this time. And this bloating may extend for a little while past when they are expecting their periods. Again, the bloating is due to the effect of progesterone, which slows down the movement of the gut. And so you find out that you eat and you are easily full and your stomach feels like it's just kind of protruding out there. What you do is it will serve you good if you eat in small quantities instead of large meals at a sitting. One of the other things that you may notice early in your pregnancy, if you pay particular attention, is that you may be having mood swings. 1 minute you are happy, 1 minute you are sad. You may even cry over things that you usually will not cry over, all because of progesterone, which causes you to kind of swing here and there when it comes to your moods. Again, you find yourself visiting the bathroom a little bit more often than before to urinate. And again, this is due to the fact that when we get pregnant, the volumes of blood that the kidneys are dealing with is increased. So there's a whole lot of volume of blood that is passing through the kidneys to be filtered. So you are going to have a little bit more of filtration at the ureters, and then that is going to come out through the bladder as urine, and you are going to want to visit the bathroom a little bit more often than you used to. And then finally, you may miss your period, which is kind of one of the definite things that you notice that may tell you that you are pregnant. Your periods, which were supposed to come, will not come at all. But even with all these signs and symptoms, does it really mean that you are pregnant? Unfortunately, many of these are not unique to pregnancy, as I already said. They may indicate an illness or that your period is simply just about to start, as a lot of women may find to their disappointment, especially when they are looking forward that this month may be the month they actually get pregnant. And somehow they are seeing some of these signs and symptoms, and they think, yeah, this may be it. But it may just mean that your period is about to come, or that you're under really a lot of stress, so your period has delayed, or that you are ill for one reason or the other. Likewise, pregnancy may happen without you having any of these signs and symptoms at all. So some women may get pregnant, but they may not have any of these at all. However, if you missed a period and you have some of the above, take a home pregnancy test or come see us, your healthcare providers. If your home pregnancy test is positive, make an appointment to come and see us. The sooner your pregnancy is confirmed, the sooner we can begin your wonderful pregnancy experience with us. So then, yes, you tested at home, you missed your period, you had some of these signs and symptoms, and you are pregnant. Yay, I'm so happy for you if you are happy about it. But for some women, some common ailments or disorders in pregnancy may threaten to steal this joy that they've been looking forward to for so long. These ailments are common and considered minor, but may really be troublesome for some women. I remember somebody said that it's good that we all get pregnant. Otherwise, if it's only one person who gets pregnant, then we'll say that that person is really something else, because some of the things that some women go through can really be troublesome and annoying, and you may tag them as being extra, but it's just that some of these things are quite difficult to deal with. So let's take some time and go through a few of them and see how we can manage them. So I'm going to go through a few of the ailments that we will go through. Some people will go through. Some people are so lucky they do not have anything at all. So these are the people who will probably be pregnant for about 3 months before they realize it, because they probably have irregular periods, and so they don't notice that their periods are not coming, because they are used to their periods not coming that often anyway. But if you are one of the few special ones, I'm not going to say unlucky, who would happen to have some of these disorders, there are ways in which we can manage them, if not even totally get rid of them. And so I'm going to go through a few of them, and then you can put some of the ones that you probably have gone through that I do not talk about in the chat box or on Facebook or wherever it is that you are interacting with that. And we will get through them too at the end of this. So the first set of disorders I want to talk about is digestive and food-related disorders, which is really some of the pesky ones. So we have nausea and vomiting, which is especially common in the early months of pregnancy. It can occur at any time of the day. You may have heard of morning sickness, but trust me, there is nothing morning about the sickness if you are really into it. Some can come any time of the day. I remember mine used to come in the evenings, go figure. Right after I've had my evening meal, that's when I feel really, really sick. And so it's the time of the day I don't look forward to at all. So it can occur at any time of the day. However, for some women, they do usually disappear by 14 weeks. For some of us, we tend to carry it for the rest of the whole 9 months until we actually deliver. So if you're one of the lucky few who don't get sick at all, or yours will disappear by 14 weeks, then that's something to look forward to. So one of the things that you can do to manage the nausea and the vomiting is to stay away from odors that tend to upset them. So I remember in one of my pregnancies, the only soap that I could use to do anything was key soap, because that's the only one which smell I could bear. Anything else makes me throw up. So you kind of have to go through and find what is causing me to really feel nauseous or nauseated, and just try to stay away from it. And I remember my husband had to put on his perfumes in his car when he sits in his car, because I just couldn't stand it. So you can't put on the perfume around me. It's not going to work. Then it will be better if you eat like 5 to 6 smaller meals throughout the day instead of having 3 large meals at a sitting. This will help you to control the vomiting, and you may not get so nauseated. It's also good if you could snack on protein-rich foods and skip foods that are greasy, which is probably going to cause you to throw up. Also good if you could eat dry snacks, example crackers, very early in the morning. And talking about dry snacks, one thing I keep telling my patients, which I personally swear by, is the dry roasted corn, what we call in Chile. It's really, really good for pregnant women who are nauseated. Even if you are not pregnant and you just feel nauseated all the time for one reason or the other, I swear by this. Interior is like my go-to thing. I keep it in my bag all the time. If I'm having any problems with nausea, that's it. I go for it. And it's like one of my first aid things that I keep in my first aid kit. Some people also like ginger. Ginger also works for them. So what some people do is to cut it in small pieces. You don't have to chew it if it burns you. Just keep it in your mouth, and it tends to just keep away that nausea and vomiting. So as well does bitter cola, the besan that some men chew. Just cut that one into pieces as well. You realize that you may have to kind of go through a few things to find out what really works for you in controlling your nausea and vomiting. However, if none of these things work, just come and see us. We have other medication. We have medication that can control nausea and vomiting. But for the purpose of this presentation, we are just looking at some of the home remedies that you can do yourself to help you. If nothing works, come in and see us, your healthcare providers, and we would help you get through it. Then another digestive and food-related disorder is heartburns, which a lot of people complain about. So this is a painful sensation that is felt in the chest caused by reflux of stomach acid into the throat. So Later on in pregnancy, it is caused by the growing uterus or the womb that is pressing the stomach. So the uterus is growing and expanding and it's kind of squeezing the stomach into a space that it is not comfortable with. So when you fill it with food, then the food kind of regurgitates into your throat and it causes a burning sensation because there is acid in our stomach. However, early on in pregnancy, it is caused by hormonal changes, as most of the issues are caused by hormonal changes. That causes slow emptying of the stomach, so the contents kind of build up, and some of it regurgitates into your throat, and it causes that heartburns that you feel. How to get over it is to eat smaller, frequent meals, and instead of large meals, and avoid greasy and spicy food as well as drinking coffee, which tends to aggravate the issue. And then you should also avoid lying flat immediately after having a meal. Just sit up for a while, just sit. Even if you are inclined at an angle, it's better than lying flat, which is going to aggravate the problem for you. Another minor digestive and food-related disorder is constipation. A lot of pregnant women do get constipated, and it's caused by hormonal changes that decrease, again, the rhythmic muscular movement of the gut. So it slows down the movement of the gut. So consumption of iron-containing prenatal vitamins, which is what almost every pregnant woman have to have because of the growing baby taking so much iron from you. And then the pressure of the growing uterus on the rectum. The uterus is directly in front of the rectum. So when it's growing, it kind of presses on the rectum, and so emptying it becomes a problem. So these things aggravate constipation. How to solve it is to eat more fruits and vegetables that contain fiber, eat whole grains, brown rice, whole wheat instead of the white rice and the white flour or white bread that we usually do, and drink at least 8 cups of water, clean water every day, and then move and walk and exercise daily. A lot of my pregnant women come to me and ask me, can we still continue exercising? Yes, you can. Just exercise that you are comfortable with, walking, nothing too serious. I tell them moderate to low intensity exercises are okay for a pregnant woman, especially if your doctor has not told you do not do any exercise because you are having a high risk pregnancy. Otherwise, exercising is good and it will help the bowel movement so that you do not get constipated. And then the fourth digestive and food related disorder that I want to talk about is food cravings and dislike. So a pregnant woman may suddenly dislike a food that she usually liked. I remember when I was pregnant, suddenly I couldn't stand the smell of green pepper. If green pepper is in my food, that's a turn off. I'll throw up, I'll dislike it. I won't be able to. I couldn't cut onions, I couldn't cut garlic. Everything was just an aversion. And it's not that the woman is trying to escape cooking. She honestly really cannot stand this. And so the cooking may have to be taken over by somebody else, hopefully the partner, my wonderful man. So you may have to take over the cooking for a little while until she feels better. It is okay not to eat the food that you don't want to eat, and you probably begin to like it again after birth. But everybody should be careful that the rest of the diet contains a lot of nutritious food, contains all the classes of the nutrition that you need to help you and to help your baby that is growing inside you. So if you are certainly averse to every nutritious food, but you only like fast food, then that's a cause for worry because you're not going to get the amount of nutrition we need you to get. Because remember, the growing baby is taking all their nutrition from you, and the baby will take it until a point where there is nothing for you to give, and then the baby will start to suffer. But you will start to suffer first before the baby will start to suffer. So don't only eat KFC, which is nice once in a while for you to eat. Don't only drink soda because that's what you feel like eating. You need to get some nutritious food into you. Make sure you have all the classes: carbohydrates, proteins, fats, and oils, and nuts and seeds and all that, so that you are not undernourished. A food craving, which is also known as pica, is a strong desire to eat a certain food or even something that is not food at all, like black soil, chalk, or clay, which we call shire, or the Ghans will say yellow, I think. Yellow. Yeah, the clay. It's sold in the market. It's panders to pregnant women. And pica is all right if you are craving for nutritious foods like beans, fruits, vegetables, and eggs. But it is not okay to eat clay or to eat soil or to eat chalk, especially when you are pregnant, because it may be harmful to you and your baby. So if a woman is craving for these things, it may be because she's deficient in some vitamins and micronutrients. So it will be better for you to talk to us so that we can augment your food with vitamins and micronutrients instead of relying on some of these things to help you get along. Then the next class of minor ailments or disorders I'm going to talk about are swollen veins and water or fluid retention. The first one I'll go off talk about is varicose veins. This is caused by pressure of the enlarging uterus on the veins that return blood to the heart from the legs, which cause varicosities, what we call varicose veins. The veins in the legs are most commonly affected, but very rarely swollen veins may develop in the external genitalia, that is on the vulva, or what we commonly call the vagina, the outside of the vagina. And these can be very painful. So how to manage them is to avoid standing for prolonged periods and sitting with your legs crossed. So don't sit with your legs crossed, it will aggravate the situation, and don't stand for too long. When you sit, try to put your foot up as much as possible, as this will help to ease the discomfort. And then strong stockings or elastic bandages may also help for people who really have bad varicosities. And then a sanitary pad may help to support those with vaginal varicose veins, because if it's ideal to wear loose cotton underwear when you are pregnant, but this may make the varicose veins just hang there and throb and be painful. So a sanitary pad, a very thin one, may help to support these and may help so that it doesn't cause you so much pain. Then let's talk about hemorrhoids, or what we call piles, or what we call cocoa. Cocoa, I don't even know why we call it cocoa, but cocoa is like everywhere. So that's also a common minor ailment of pregnancy, not so minor for some people. And some people just specifically develop it when they get pregnant. So these are swollen veins around the anus. They may burn, hurt, or itch. Sometimes they bleed when the woman passes to, especially if she's constipated. So you want to avoid getting constipated by eating diet that is high in fiber, such as wholemeal bread, fruits and vegetables, and drinking plenty of fluids. When the problem is really bad, if the hemorrhoids come and they are really swollen and throbbing, sitting in a cool bath or lying down can help. If it's so bad, there's nothing that can be done about it, please come and see us. It has moved from being a minor disorder to something that we need to help you. So come and see us, your healthcare providers, so that we can help you get through that. Another thing too that I want to talk about is what we call edema. And these are swelling of the ankles, the feet, and the fingers, especially during pregnancy, as fluid is retained more than usual in the body during this period. Swelling of the feet and ankles often occur at the end of the day after a day of walking and standing. This gradual swelling is not harmful to you or your baby. So what you can do, however, if you see swelling, you wake up early in the morning and you see swelling of your feet and your face, that is not the normal edema of pregnancy. That may mean that you may have preeclampsia or even a kidney disease, and you need to come in and see us. This swelling that I'm talking about, that is the normal minor disorder of pregnancy, is something that you will notice as the day progresses. So as you are walking and standing, then you know that gradually, so that by the end of the day, your feet are really swollen and they probably do not even fit into your shoes. So what you can do is to refrain from standing for prolonged periods and try to wear very comfortable shoes. I think this is where we come off telling pregnant women that they can't wear high heels. So a lot of women advise pregnant women to wear flats. If a pregnant woman, however, is comfortable in her high heels, I'm okay with it, so long as it's not causing her. And if she wants to slay whilst she's pregnant, hey, go for it, girl. I'm okay with it. I definitely like to slay when I'm pregnant. I mean, I'm dealing with enough already without having to wear something that I'm not comfortable with wearing at all, which is flat shoes. And then you need to put up your feet as much as possible. So if the edema is really bad at nighttime when you are sleeping, just put a pillow at the level of your feet and just elevate your feet on that pillow. Or if you are sitting down, you can have a small stool that you can put your feet up on, so that the edema, your feet are not hanging, and then you have fluid retention at that most dependent part of your body. Then let's talk about aches and pains, which is also one of the most common complaints of pregnant women during pregnancy. And the first one that I will talk about is backache. So the weight of the baby, the uterus, the amniotic fluid, that is the fluid which the baby is swimming in, changes a woman's posture and puts a strain on her bones and her muscle. So sometimes you can even recognize a pregnant woman. You can even recognize a woman is pregnant just by looking at her back, because she has this posture that, you know, it's like the uterus is putting so much weight, a strain on her. She stands in a way that she's comfortable. Standing in long standing in one place or leaning forward or hard physical work can cause backache. So what you do, if you are somebody who sits a lot to work, you can support your back with a cushion, because you know most of our chairs are not ergonomic, they are not postured right. So you can support your back with a small cushion so that you are comfortable. And then if the pain is really bad, you can kneel on the floor on all fours, what we call on all fours. So you are kneeling on your knees, and then you put your hands two forward, and your back is, and then you gently rock your from side to side. That can help to relieve the pain. Sleeping on one side with a pillow in between your legs is also a good way to get comfortable when you are sleeping. Let me tell you about pregnancy and trying to find a good sleeping position. It is not easy. So people come asking, so I'm told I cannot sleep on my tummy when I'm pregnant. Yes, it's not advisable to sleep on it, especially when the uterus, the abdomen has come forward so much, and it's not even comfortable. You can't even do that. You can't sleep on. But until you get there, in your early pregnancy, I tell my clients, sleep as much as possible. If you're somebody who likes sleeping on your tummy, get more of it before it comes to a time when you cannot do that. And then it will come to a time when the only way you can get comfortable is sleeping on your side. But if you can do that with a pillow in between your legs, then you find you get more comfortable. There are also pregnancy pillows around these days that you can invest in, and it may help you. You can sit with your back straight and well supported. That's also another way. Use a hot or cold pack on the sore part of your back, and having your partner, our wonderful partners, give us a back massage, or even if your partner is not that good and giving massages, maybe they can pay for you to go and have a massage somewhere. That can definitely help, and we will feel the love, because you are doing all this work, and then he comes and rubbing your back. That is nice. It can also lead to other things that are useful in pregnancy. But if they are not so good or comfortable, or they were not trained to do that, then investing in having her, giving her a ticket to go and have a massage somewhere will definitely put points in your bank. Another ache and pain disorder of pregnancy is joint pains. And I find this to be quite a very, very common complaint among pregnant women. So hormones in the third trimester act on the woman's joints so that they get softer and looser. This is so that when it comes to the time when baby has to come out, all the joints are soft and loose and not so stiff, so that the baby coming down the birth canal, it can cause stretching and everything will be nice and loose and baby can come out. However, these softer, looser joints can be painful, because when it makes the joints more flexible, including the joints between the bones of the pelvis. And so it makes the joints too loose, and sometimes it's unstable. The pelvis become unstable, which produces pain. So a lot of women will come complaining of pain in the area that we call the mons. Just on top of their pubic bone, there is a lot of pain over there. And it can be really, really so painful. You say, when I'm getting up, it's painful. When I'm moving, it's painful. Everything I'm doing, I'm just having pain in my pelvic area. It's because the pelvis has become a bit unstable, because it's loose and is more flexible. It is not harmful to the baby, this joint pain. It's just painful for you. So we should try and stabilize the joint as much as possible by what I tell my clients is try and keep the legs together, especially when you are moving in and out of bed. This is the time when most women complain of pain. So instead of you are in bed, you're about to get out, these are your legs, you put one leg on the floor and then you join it with the other. Instead, rather try keeping both legs together. So you have both legs together and you swing them both out of bed. And then when you are getting in bed, you sit on the bed first and then you swing both legs onto the bed. I tell my clients to do the same thing when you are getting into and out of car. You sit first with your butt on the car seat and then you put both legs together and you swing both legs into them. When so do you are stabilizing the joint and it's not becoming so unstable and painful. And you find that it really helps. However, if the joint pains are so unbearable, please come and see us, your healthcare providers, and we will help you get through this not so minor disorder of pregnancy as well. And then let's talk about leg cramps, which or what we call muscle pull. This is a sudden sharp pain and tightening of the muscles of the legs or the feet. And this is very common in pregnancy. And funnily enough, they come most especially at night or when a woman stretches and points her toes. I don't know why it comes most. You'll be sleeping comfortably, or as my Nigerian friends will say, you'll be sleeping gingerly. And then all of a sudden, you have this sharp pain that will cause you to scream out all of a sudden, and nobody even knows what is wrong with you. Why are you screaming out? Are you in labor? No, you are not in labor. It's just that you are having a muscle pull, a terrible leg cramp. So to stop the cramp, you just flex the foot, you point it upwards, and then gently stroke the part of the feet that is aching. Usually is the calf. You gently stroke it. Don't stroke too hard, just gently stroke it, and eventually the leg will relax and then it will stop hurting you. To prevent more cramps from coming, eat more foods that are high in calcium and potassium, which may be helpful. And then headaches. So let's now talk about headaches. Headaches are very common in pregnancy, but they are usually harmless. There is also due to hormones that cause the heads to ache so much. Headaches may stop if the woman rests and relax more, drink more juice or water, and gently massage her temples. However, headaches that are late in pregnancy may be a warning sign of preeclampsia, especially if there is also high blood pressure or swelling of the hands and face, as I said before. So if you're having headaches early in pregnancy, they are not so disturbing. Don't worry about it. If it's something that you sleep a bit and it goes away, or you take a paracetamol every now and then it goes away. But however, if the headaches are persistent or it's only one side of your head, what we call migraines, or it's late in your pregnancy, please come in and see us, and then we will make sure that it is not preeclampsia, which is definitely a very, very major disorder of pregnancy. So now the last batch that we are going to talk about, of things that we are going to talk about, are other ailments, which doesn't really fall into any of the other classes that I've talked about, digestive things, or aches and pains, or swelling veins and fluid retention. These are just other miscellaneous ailments of pregnancy. First one is vaginal discharge and thrush, or candidiasis, or white. Pregnant women, even right from the beginning, often have a lot of discharge, but it's even more pronounced at the end of the pregnancy. You can be discharging, you may be soaking, if you are wearing panty liners, you may be soaking them every now and then. The discharge is usually clear and white and should not smell unpleasant. However, if the discharge is colored or smells strange, or there is soreness in the vagina or the vulva, or there is itching or a burning sensation, it may be a sign that you have a vaginal infection. Thrush or candidiasis or white is a yeast infection of the vagina, which is quite common in pregnancy, but easily treatable. So if you've noticed that you're having a lot of discharge, it may be normal, but if you feel it's abnormal, please come and see us. Or if your discharge is causing soreness or itching or burning, then it may be a sign of vaginal infection. And again, I will kindly ask you to come in and see us so that we can walk you through it. Then let's talk about stretch marks and striae. Very, very harmless, minor ailment of pregnancy, but one that is very bothersome for most women. These are raised red lines on the breasts, the abdomen, the thighs, or the bottoms, and are usually permanent, unfortunately. They come and they stay for life. It's your battle marks, it's your war marks, it's the sign that you've been through the meal and you've come out victorious. These are war marks. You know how men go into battle and some have scars from guns and things in shrapnel that may have hit them during the war, stretch marks are battle marks for some of us. However, I do have some clients who, even late in pregnancy, their skins are as smooth as a newborn baby's bottom. They have nothing. And I really, really hate these women because they don't have any battle marks. Stretch marks happen whenever the skin is stretched and affect up to around 80% of pregnant women. The likelihood of getting stretch marks increases if your weight gain is more than average during pregnancy. So we might want to keep an eye on how much weight we are gaining. Even though, to be honest, I do tell my clients, pregnancy and the period of pregnancy is not the time to kind of keep an eye on dieting. No, I'm only worried about the weight gain of my clients who may have diabetes or may have preeclampsia. Otherwise, this is not the time you want to go on a diet. But if you gain weight rapidly or more than average during the pregnancy, then stretch marks or striae is one of the things that you may have to worry about or contend with. Certain creams or cocoa butter may help to lighten these marks, but keep in mind that they are usually permanent. But over time, the skin will shrink and the stretch marks will fade into white colored scars or brownish colored scars if you are black like me. Then another minor ailment of pregnancy is sleeplessness or sleep disorders and tiredness. Some pregnant women, especially early on in the pregnancy, you may feel that you are very tired and exhausted and you tend to sleep all the time. It is common and it is normal because you are having to wake up a lot more times to pee, you are having aches and pains, you can't really find a comfortable position in the bed, your mattress is too soft, your mattress is too hard, your mattress is not mattress enough, everything irritates you. And so the time that you are supposed to be sleeping, you can't really sleep and you are tired for most parts of the day. However, some pregnant women also find it very difficult to get to sleep at night. Also, because they are anxious, they are having heartburns, the baby is pressing on the bladder or just doing gymnastics on the bladder, practicing for the Olympic Games on the bladder, or just the sheer bulk of the uterus pressing on the bladder. It makes it difficult for you to get a good night's sleep. And so again, during the day, you are tired. However, so these things may all be common because of some of these reasons that I talked about. However, but for some women, sleeplessness may be due to the fact that they may be anemic. And so if you find that you are sleepless and it's really worrying, please do come in and see us. And let's make sure that you are not anemic or having some other ailments that may cause you to not be able to sleep. A hot milky drink and a warm shower may help you to relax and try to get as much rest as possible. You may also find it helpful if you avoid caffeinated drinks such as coffee, which can make it harder for you to sleep. And watch out for the hidden caffeine in some drinks that you may not think may be caffeinated at all, but usually are. And then another common ailment of pregnancy is incontinence or the leakage of urine from the urethra. So you find out that when you are laughing, you are sneezing, you are coughing, and you leak a little bit of urine, which can be really, really unpleasant and uncomfortable, especially when you are in public. But it's really, really normal. It's sometimes due to the bulk of the uterus pressing, the extra weight, and the pressure of the baby pressing on the bladder. But it's also sometimes due to the hormones that has made everything more relaxed, including the sphincters. So incontinence is actually quite common in pregnancy. However, and the pelvic floor, especially when you laugh, you sneeze, or you run. Regular pelvic floor exercises during and after pregnancy will help you with this incontinence problem, because for some women, this incontinence may extend beyond the period of pregnancy, and they even realize that it may stay for life. So you might want to learn how to do pelvic floor exercises or Kegel exercises. You can go online to see how that helps, but let me just quickly take you through how you can do the Kegel exercises, which is really, really helpful for a lot of other things to do with the pelvic floor. So when you are urinating, you're on the loo and you are trying to pass urine, just stop in the middle of passing the urine. Consciously make an effort and stop it. So that's muscle that you use to stop the urine from flowing. those are the muscles you want to target. So now that you've identified the muscle, every now and then when you are sitting, you want to just contract and hold these muscles for just about 30 seconds and then relax, and do it and then relax, and do it and relax. When you find yourself free, just look for those pelvic muscles, those pelvic floor muscles, and just contract them. Just hold it, like how you held it when you were peeing, and then you try to stop the pee in the middle of it, and then for about 30 seconds to 1 minute, and just relax it. And gradually, that's you training your pelvic floor exercise. They'll become so strong, your husband will thank you for it. Trust me, I'm a doctor. And then the last ailment that I want to talk about before I get into your comments and your questions about some ailments that I may not have mentioned, or something that you are going through that I have no idea about at all, I haven't talked about at all, is feelings about sex. It's going to be very amiss of me if I come here to talk about things concerning pregnancy and I don't talk about sex. Or it's just going to be very amiss of me if I just talk and don't talk about sex. So some women do not want much sex when they are pregnant. Others want more sex than usual, and both feelings are normal. Whether you are the one who wants more or you are the one who doesn't want at all of it is normal. Some clients will come to me and tell me that I should tell their husbands that I've told them they shouldn't have any sex. Okay, you can use my name as an excuse not to get any. And then some women just want to have a go at it all the time. I hope, luckily for these women, there are some men who are also very interested when a woman is pregnant. Their libidos just shoot up. And there are some men who are also a little bit put off by pregnant women. Just as a woman wanting more or wanting less is normal, it's also normal for the men. Let's not get beat up about this. Having sex, not having sex are both okay for a woman and her baby, unless your doctor has specifically put you on pelvic rest. Because maybe, especially early on in the pregnancy, maybe having sex may put you at a risk of threatened abortion. Or maybe later on in the pregnancy, maybe one of the major disorders is that your placenta is lying a bit low, and so we cannot risk you having sex, and it may be hazardous or harmful for you and for the baby. Sometimes, so having it or not having it is okay, unless you have been specifically put on pelvic rest. Sometimes sex is uncomfortable in pregnancy, and it's up to the woman and her partner to try and find a position that is comfortable for both of you for making love. So it may be the woman may want to get on top. That's something that she may find comfortable. Or maybe in a sitting or a standing position. Please do not ask me to describe how the standing position is. I found it in the literature I was using. I have no idea how you stand to have sex. But if it's a position that you've done before and it's good and it works, it will work during pregnancy. The woman on top, yes. The sitting position, yes. Standing, no, I don't know, but the literature recommends it. Or a woman lying on her side, which is also a very, very good position for a pregnant woman to have. Just lying comfortably on her side, the man approaches her from the rear and then enters through the rear, and it's a very comfortable position for the woman. And it's also marvelous for the woman to get sensation and have control of her own pleasure as well. So these are some of the minor, in quotation marks, ailments or disorders that some women experience in pregnancy. Some of it may tend to go a bit beyond minor into being not so minor. But I've shown you some ways that you can get through them, manage them on your own. However, if they do not work, come in and see us, and we are always there to talk to you and to help you make this pregnancy journey as positive and as exciting for you as possible. So we'll now go on to the chat room and see if anybody has any comments or questions that they may have. Okay, so the first one I want to get into, somebody asks, is it abnormal if somebody doesn't experience these normal symptoms, the symptoms that I talked about? Absolutely not. I mentioned that it's not every woman who is going to have some symptoms. In fact, some people get pregnant and for the whole 9 months, they apparently do not feel anything until they go to the hospital with an abdominal pain and they are told you are in labor. I mean, you watch the documentaries about such people, like I didn't know I was pregnant or something. I think there are some things like that on TLC, and they just get to the hospital because they are probably big already and they thought they were just getting fatter. Or some people don't really get even that big in pregnancy, and then they just go. So it's absolutely normal for some people not to have any of these signs and symptoms at all. Or some people, for them, they may come late. And I think these people are super lucky because some of these signs and symptoms, like I said, may be very uncomfortable, especially if you do not have a good, strong support system and you are kind of have to deal with this all on your own. But otherwise, it's normal. It's not abnormal at all if you do not go through it. Somebody says she's experiencing all that I'm talking about and they are staying. I feel so bad for you, Zayati. Miss Hassan, I'm so sorry for you, but don't worry. Just look at it that a few more weeks, when I'm pregnant, how I manage to get through all these symptoms, because some of these symptoms, I go through them and they stay. What I do is that initially I will count the pregnancy times in months. I won't count them in weeks, because if I count them in weeks, then they are going to seem so long. 40 weeks is a lot of weeks, or even days. So I count them in months. It's 9 months. And even the 9 months, by the time I realize I'm pregnant, it's like 8 more months to go. And then by the time the first trimester is gone, it's just 6 more months to go. And then it's 3 more months. So when I'm getting closer to the end, that's when I will start counting in the weeks. And then when I'm really close to the finish line, then I'll start counting in the days. So you get through it. But you know the exciting thing, especially when it comes to vomiting, it's been said that people who vomit in pregnancy are probably going to have their pregnancies continuing. You know, unfortunately for some people, early in the first trimester, they lose pregnancies, and quite a lot of women. So they say if you have feelings of nausea and vomiting, which is due to the hormone HCG, then it means that your hormone level is high, and the higher the level of HCG that is in you, the more likely your pregnancy will stay. So take a little bit of hope from that. Ivy says she can relate to the perfume bit. Ivy, I'm telling you, smells and perfumes during pregnancy, it is not a joke. I mean, most people are fighting. Some people fight with their partners because, you know, even deodorant, you can't put on deodorant because every one of them. So you kind of have to go through a lot of deodorants to find which one is agreeable with you. Otherwise, you are going to go around without even deodorant, and maybe the lime may be your best friend during pregnancy. Perfumes, nope, not a friend of a lot of pregnant women. Vanessa is asking, I find it difficult to sleep in my second trimester. Is that normal? Yes, Vanessa, it's a bit normal for you not to be able to sleep in your second trimester because of the growing baby compressing on a lot of things. So you are tossing and turning, you cannot find a good position in bed, the mattress is too soft, the mattress is too hard, the mattress is not just mattress enough, and it's just difficult for you to find a comfortable position to sleep in. But if this sleep is like you can't sleep at all, so make sure you're not taking caffeine or caffeinated drinks. Try taking a warm shower in the evenings or drinking warm milky drinks, like warm cocoa, hot cocoa. However, if it's because you really find it difficult, you may have anemia, so just come in and let's check you out. If you do not have any of these, any illness or anemia, then it's just normal. And sometimes late in pregnancy, it's also difficult for you to sleep because some people say that the nature is preparing you to do those late night feedings that you have to feed the baby. You know, when the baby finally comes out, you are going to wake up like every 2 hours in the night to breastfeed it or to feed it the formula or whatever it is that you are giving it. So your inability to sleep is sort of a practice run for early motherhood. Amanyakon is asking, is it safe to take Coca-Cola in the first trimester? I really wouldn't recommend you taking Coca-Cola in the first trimester, just because it's soda and it contains caffeine and it's going to cause you to urinate a lot and it's going to cause you to take in a lot of sugar, which we really don't want you to take because we don't want you to develop diabetes later on. But later on, after and then the baby, most importantly, because the baby is developing every organ that is going to use later on in life. The heart is developing, the lungs are developing, the skin, every organ, the kidneys is developing really in the first 8 weeks to 10 weeks of the pregnancy. By 12 weeks, the baby would have developed everything it needs to develop. And the only thing that is going to happen is those things are going to mature. They are going to get bigger and better in function. But by 12 weeks, everything has developed. So you don't want to take anything that may potentially be harmful to the baby. That's why early on in pregnancy, we try to get you not to take as many drugs as you know, we want you to go the natural way, so that if the natural way doesn't work, then we eventually come and start giving you drugs. And then it's better if you are going to take drugs that you consult your healthcare providers, so that we'll give you the drugs that are safe in pregnancy. Because early on in the pregnancy, as I said, the baby is developing everything that they are going to use, and you don't want them to have any problems with any of these things. But afterwards, after the first trimester, if you want to go ahead, if Coke is the only thing you can drink, it's cool. Someone is asking, Doc, is it true that when pregnant women have swollen feet and face, it means that the gender of the baby is a male? Well, not really. These are old wives' tales. Some females also come in quite strongly when it comes to the edema. But I've only had boys, and I've had swollen feet and swollen, well, not so much the face, but swollen feet throughout my pregnancy. And some people who've had girls and boys say that for the girls, the pregnancy was a little bit easier. But like I said, everybody's pregnancy is kind of different. So people may be having different experiences. It's because somebody had a female child and she said that pregnancy was worse than all the others that she had. So it's really different for everybody. Abna is asking, is muscle pains, especially on the wrist, common during the third trimester? Yes, when I was talking about the aches and pains, thank you, Abna, I forgot to mention about carpal tunnel syndrome. Yes, some people have muscular pain. Well, it's not really muscle pain. It's just that the relaxation of the joints that I talked about will cause your joints as well as your wrist joints become so lax that it's very painful, and some people even need to have the wrist supported. So it's common and it's considered a minor ailment of pregnancy. It's common in some people and it's minor, and if it's so bad, then we'll give you a rib strap and give you painkillers as well, which may help. Mami Anamua is asking, why does my vagina hurt unbearably in my second trimester? So again, this is due to the joint pain that I was talking about, and it's for some people it can be really unbearable. I experienced this one in my second pregnancy. In the first pregnancy, I didn't notice any of such pains that were talking, but in the second and third pregnancies, I had this pain, this pelvic pain. It's like your pelvis is splitting, especially when you are getting up from standing, and or you are just lying down, you are moving from one lying position to the other, and the whole area is just throbbing, and you can't, it's just unbearable. So what you do, if it's really, really unbearable, come in, we will give you painkillers to help the pain. Otherwise, try keeping your legs together as I taught you, to just stabilize the pelvic joint as you are moving, even in bed, or moving from a sitting position to a standing position, moving out of bed, moving from vehicles. Just keep them together and they may help. Ifua is asking, I fainted at work when I was about 6 months pregnant. Is this common in pregnant women? Ifua, fainting is not something that we take lightly at all. So I didn't even mention it among the minor ailments of pregnancy. It may be due to the fact that maybe your blood pressure was a bit low. And so if you move suddenly from, let's say, the sitting position into a standing position, you just became very lightheaded and you fainted. But fainting is not normal, it's not common. And when you do, you need to be seen by your healthcare provider. Helena is asking, is it normal for a pregnant woman to be taking BP medicines throughout the pregnancy? It's not normal, but it's done. Let me just say, because some women are hypertensive before they got pregnant, which means their BPs were high. So they are already on BP medication before they got pregnant. So they need to continue it throughout the pregnancy. Otherwise, your BP is just going to shoot out of range and you are going to have problems with that. However, you may be on some antihypertensive medication that is not safe in pregnancy. So if you are on BP medication before you got pregnant and you realize that you are pregnant, please contact your doctor or your midwife so that they can check your medication and see if that is normal for you to take in pregnancy, if it's safe for you to take in pregnancy, and continue. For some women, they will develop the BP during pregnancy. And for such women too, they are prescribed. Usually those start from the second trimester or the second half of pregnancy after the 20 weeks. And such women are prescribed BP medication to take for the rest of the pregnancy. Now, Adoko is asking, is it normal to feel hungry always, yet no food tastes good anymore? How does one deal with that? Yes. Unfortunately, for some women, well, especially early in pregnancy, food doesn't taste good at all. And you really want to eat, but you have this metallic taste in your mouth. After you eat, the food is kind of like stuck in your throat and it's not going anywhere. And it's really, really uncomfortable. So you don't even want to eat. It's normal to feel hungry all the time because you are eating for two, so to speak. And food not tasting good is also normal in pregnancy. How you deal with it is to really, you kind of have to try and go through. So for such people, I'm going to put down my rule of saying don't do only fast food. If it's only KFC that you feel like eating, go ahead, because you need to eat. At least KFC will give you some protein and there will be some fats in there and there will be some carbohydrates from the chips or the rice. So go ahead and eat it. Just make sure you are getting a bit of fruits. Find the fruits that you can be really agreeable with. Just make sure it's not strawberries alone or grapes alone so that you break the bank in the house. Find some fruits that are really agreeable with so that you balance it with vegetables as well. But it's normal to feel hungry and to have food aversions. Achua is asking, please, how does one stay hydrated when drinking water is a problem? Yes, drinking water, you need to drink a lot of water during pregnancy, especially in the early parts of pregnancy. But drinking water is such a hardship for a lot of pregnant women because water just does not taste that good. It's like when you are having malaria and you have to drink water, you know that metallic taste in your mouth. I find that how you can get over that is to drink very, very cold water. In fact, water that has ice in it. That is the only way to get you through it. So you say, but doctors told us not to drink cold water. This doctor is telling you when you are pregnant, drink very cold water. That's the only way you can get the amount of water you need to drink in a safe time. So carry water that has ice in it, sip it small, but make sure throughout the day you've had about 8 cups of water to drink, very cold water. Grace wants to know, is it true that you always have to lie on your left throughout the 9 months? Well, we encourage people to lie on the left lateral side because it takes pressure away from your aorta and your inferior vena cava, which are the big blood vessels that are returning blood to the heart. And so it helps the baby to get a good circulation into the placenta and to the baby. However, you don't have to lie on your left throughout. If you can lie on your left some of the time and lie on your right some of the time, I will not fight with you, so long as you are comfortable. And that's why I said early on in the pregnancy, when the uterus is not that big, use your comfortable pregnancy positions before you get to the stage when the uterus is so big that you cannot lie on your tummy, you cannot lie on your back. Early on in the pregnancy, when the uterus is not that big, you can lie on your back. So the first 3 months, maybe even up to 4 months, you can lie on your back. You can lie on your tummy if it's comfortable for you. But as your uterus gets big and it compresses, then lying on your back is a no-no because it's going to stop. It's going to reduce the amount of blood that is getting to the placenta and to the baby. So then we want you to lie on your side. Left or right, ideally the left, but if it's the right you are more comfortable with, I'm happy at least you are getting some circulation to the baby. Rue says, I've been vomiting and having nausea since week 4. I can't eat, I can't drink anything. Please, would it affect me? I had IVF for 3 times. Congratulations in the first place, Rue, for your baby. I'm so happy for you that finally you are there after 3 tries. Vomiting, like I said, is a good sign. So at least we are thankful for everything. The Bible says we should be thankful. So we are thankful that you are vomiting because it means you're having high levels of HCG. However, if the vomiting is so bad that you can't eat and you can't drink anything, please come in and see us so that we can either give you medication to help control the vomiting or we can give you fluid replacement because when you lose so much fluid too, it is not good for you. So if it's so bad, if you are vomiting, say 5 times, more than 3 times a day, is definitely not normal and you need to come in and see us and then we will help you through that. Belinda wants to know, what are the effects of COVID-19 in the 3rd trimester? Well, COVID-19 is fairly new, so we don't know what it's going to do for us because a disease needs to have been around for a long time before we can know its effects that is finally going to have on us. But for now, We are not really seeing any effects because remember, in the third trimester, by that time, the baby has formed all its body parts. So it's not scary. If it's going to be scary, it's probably going to be in the first trimester. But even 9 months after COVID-19, we are not really seeing any effects in babies that are being born whose mothers may have been exposed to the virus, unlike what we saw for the Zika virus, where the babies are having smaller heads. We are not really seeing any effects on the babies that are being born from mothers who probably had COVID-19 earlier on in the first trimester. In the third trimester, no effects so far has been documented, except maybe you feeling just bad if you have a very bad COVID-19, or the baby getting the COVID-19 from you. Otherwise, and it's fairly, I'm yet to come across any baby that has died because their mother had COVID-19 and they had it. So it's fairly safe. So we are not going to have any major effects. Thank you, Salom. Salom is saying it's very insightful. I'm so happy I've been able to give you a bit of insight into some of the minor pregnancy ailments and how to manage them. Solomon says we need more diagrams the next time. I hear you, Solomon. I'll do that. Mercy says, is it okay to feel your bum so hard sometimes in the second trimester? In the second trimester, not so. Is it okay? Normally the bump, and I'm trying to think that if you mean so hard, it may be contractions. And this usually comes in the third trimester when you are having what we call Braxton Hicks contractions. So Mercy, in the third trimester, you are going to have Braxton Hicks, which is practice contractions. So they are not painful, but you will feel your abdomen hardening up a bit and then it will relax. It's really not supposed to be painful, but it will harden up and relax. Not so much in the second trimester. If you're having it in the second trimester, you need to come around because you are not supposed to be having contractions, ideally in the second trimester. Contractions happen in the third trimester. John says, what causes leg cramps and how can it be controlled during pregnancy? So I spoke a little bit about the cramps or the muscle pull that happens during pregnancy. And it may be because you are deficient in some micronutrients like calcium or potassium. But most of the time it's just due to standing long and the strain that the muscle is undergoing. So I've said it can come. How to prevent it is to eat foods that are rich in calcium, a lot more milk and potassium. Bananas, plantain, very, very rich in potassium. So you want to eat that. However, if you get cramps, then you just flex your toe upwards and just rub the calf, gently rub it until it's gone. The partners are always good for this, so they can do this for us. Mami in Tiamwa is asking, is shortness of breath normal in the third trimester? Yes, Mami. The growing uterus can't press against the diaphragm. So you are going to have, and the diaphragm and it pushes again, so you are going to feel like you are a bit short of breath. I don't want to tag it as normal. It's common and it may be normal, but if you are really, really getting shortness of breath, especially in this period of COVID, please come in and see your healthcare providers. It may also be a sign that you are having a high output cardiac failure, which some women do tend to have. So come in and let us rule out any of these problems as being the cause of your shortness of breath. Helena is again asking, is it also true that you can have constipation in your first trimester? Yes, you may have constipation due to the slow down movement of the gastric contents. So the gastric contents may pile up and you will not be able to pass stool as frequently as you used to. So the way to get through that is to drink a lot of water and eat foods that are high in fiber like whole wheat, fruits, vegetables, and that can get you along. Joyce is asking, this is my third pregnancy and I don't really feel the baby's movements unless I look at it before I notice it moving. Please, I want to know if it's because I've gotten used to the movement or he's not kicking that hard, and is it normal? Thank you. Thank you too, Joyce. Yes, it depends on the stage of the pregnancy that you are in. For a third timer, I presume you are very experienced in noticing baby's movement, so you would know what baby movements are. But early on in the pregnancy, especially from 16 weeks onwards, the baby may be moving, but the baby is not moving that much. The kicks are not that strong for you to feel it. And then later on in pregnancy, in the third trimester, when the baby gets so big and the place, the apartment that the baby is in becomes a bit so small for it, the movement is also not going to be felt so hard because it does not have room to kick or to hit out so hard. So you are going to feel the movement more as pokes, not as kicks. So you feel the baby poking you here and there. Yes, I notice you say you are in your 8th month, and this is the stage where the baby has gotten so big, it's taking up almost all the room in the, so it's not going to kick so much, it's going to poke you a little bit. However, if the movement is really concerning for you, please come in, let us do a test on you, which we call non-stress test, or a CTG, and make sure the baby is fine, or we'll give you something what we call fetal kick count, which you can do at home and count the number of times that baby is moving when you are awake. Zayati is asking, sometimes too, I feel there is too much gas in your stomach. Yes, I didn't talk about this minor ailment of pregnancy, passage of gas. I think for some women, even noticing that they are passing gas is when they first notice they are pregnant. So pregnant women tend to pass a bit more gas than, and maybe be a bit more bloated. It's all due to the slow movement. So intestinal bacteria gets a bit more time to act on the things that are in the intestine than before, and so you may be a bit more gassy than before. So Sita wants me to talk a bit about cravings. Some ladies want to eat clay. Yes, I did mention it that this is what we call pica. Some people have cravings for things that are not even food at all. And I said, if you are craving for things that are food, it's okay, eat it, but especially nutritious food. However, if you are craving for clay and black soil and chalk, it may be very harmful to you and the baby because it may give you worms, which may in turn cause you to have anemia. So if you are having these cravings, please come and see your healthcare providers. Let's talk to it. It may be because you are deficient in some micronutrients and vitamins, and so we replace this in your diet for you, and you don't have to take the clay and the chalk and the black soil. It's been so wonderful coming your way this Saturday once again, and I'm looking forward to the next time when we get to meet again. Stephanie, thanks as well. I thank you all. It's been wonderful. I've seen so many people online. Thank you all. And I'm so looking forward. If somebody is out there and they didn't have a chance to catch the chat or the presentation, they should kindly go onto our Facebook page, the community We Are Having a Baby. They should go onto our YouTube page. The video will be on there and then you can watch it. If you still have questions, kindly post them in the comment section. I will come online and we will answer as much as we can. God bless you. Have a wonderful, wonderful evening.